All right, well, good morning. My name is John Dombrowski, and I'm here to talk to you about addictions and ways of managing addictions. So kind of tell me how you came to me today. Please, Mom, why don't you start us off?
After our son acquired his addiction through Children's Hospital from a spine surgery, we were that family that was just battling it, the roller coaster ride, up and down, up and down. I knew that we were losing too many patients a day, and that there had to be something else because it wasn't willpower that was going to save them. Right. They're dying.
And you've been dealing with this since he was age of 15, and now you're 25, I think, right now. So it's been a 10-year roller coaster, both for yourself as well as your family, your mom, right? Yep. And so I know you do some work in terms of athletes in Ohio, and you had done some research about naltrexone.
Right. I was Googling and searching, desperately looking for anything that would save his life. Right. And get this hell to stop.
And what did you find about naltrexone? What did you find out about this?
Well, I realized there was this implant that patients were receiving and that it was working. And I know that because I went into the chat rooms of the addicts and actually talked to them. I wasn't hearing it from doctors. I was hearing it from the patients, the addicts. And I asked them questions about it, and then I started just doing my homework and research and just kept at it. I wanted to kind of watch and see what side effects were going to be. Sure. And get him to a place where I could get him to agree to it. Right. That's part of the battle, too.
So tell me about, from your perspective, the whole idea of this implant, and do you think this is helpful? Do you think
at first I wouldn't do the Vivitrol. I wanted the implant because I heard you could drink, and I was still a drinker. But then once I had enough of my addiction, I finally agreed. As soon as we figure out where to go, I'll go, and.
And so you guys are coming from Columbus, Ohio.
Moringa. Well, we came from a little town called West Jefferson.
Okay.
That was really hit hard by the opiate epidemic. We lost half our football team from Jordan's high school year. Convicted felons, and these are kids that are going to struggle the rest of their lives.
How about that? I never knew that. Wow.
Ohio's ranked #1 in the nation for drug overdoses.
And so you found me through the internet then?
Yes.
Okay. And so now I'm going to just jump right in and just ask you, so we just finished your implant.
Yep.
How's it, how did if someone is watching this as a potential patient and they're going to think of an implant and, oh my God, surgery and all that sort of stuff, what would you tell them?
I got a very low pain tolerance, and I'd say it was only a 3 or 4. So it was the worst part. And the worst part was the shots in the beginning, I think. So
the shots in the beginning, you mean the local anesthesia? Okay, and that was like a burning kind of sensation? Yeah,
like a bee sting. So after that, it was, pretty pain-free. So.
And after that, how long did that take, would you say? I mean, we're here in the doctor's office, so how long did that take you?
20 minutes from the time I got my original, numbing shots to the time we were finished, I would say. 20, 25 minutes, we was done.
So we can go tour Washington, D.C. now and get these legislators to pass this, right?
That would be awesome. So, again, just in closing, if someone who is a patient or a parent is suffering with addiction, whether it's alcohol or opiates, and obviously, what would you kind of tell them to do?
Don't give up. If they're still alive, keep fighting. Don't be afraid to turn those stones. No one's looked under because...
And would this implant be one of those stones, I'm assuming, or what would you think?
From everything that I've read, yes. I mean, some patients are describing it as a miracle. And, we're willing to do anything to keep from going and visiting a headstone.
Sure.
So.
Yeah. Well, thank you. Go ahead, please, after you.
A lot of addicts, can't do it on their own. Most of them can't. I think this is the first step, to, fixing it. Turning it all around. So.
And I've heard of that. Like, in other words, there's some people that are of the belief that you have to just do it by willpower.
Willpower is not enough. That's why they're dying.
Right. And then so this is where you sort of get a supplement, to help you as you change your life around.
This is somewhere other than willpower and religion that'll, hopefully turn it around.
Sure. Well, thank you very much for sharing your story.